Hi, let's talk about brain imaging and COVID. In fact, let's talk about how brain imaging can help clinicians during COVID. COVID introduced big changes to the way we interact with each other, the way we interact with our friends, with our colleagues, and with our clients. All of a sudden, we had to reduce as much as possible the time we spent in face-to-face interactions. And that meant different things in different health services. So some health services transition to telehealth when there is no face-to-face contact at all. Other health services reduce the number of times you see a client. In other health services, the duration of the time you spend with clients changed. And in other health services, the location of care changed. So no longer could you treat them in the therapy room. You had to treat them either in their room or in their home. And group sessions were either cancelled completely or heavily modified. So you can see that different clinicians and different health services found their own way of dealing with COVID. And many times it was a combination of those modifications. COVID introduced new challenges to the way we deliver our care. We had to become more resourceful, and we had to optimize the way and the time we deliver our care. There seems to be two major factors that have affected the way in which clinicians can optimize their care. One is the amount of clinical experience they have, and two is the degree of clinical reasoning that they're using. And it's interesting to know that the clinicians that transitioned to telehealth most successfully were the clinicians that had extensive clinical experience and the clinicians that fine-tuned their clinical reasoning. Clinical experience is a circumstantial factor. You don't have too much control with regards to the type of experience you already had. But you do have control with regards to your clinical reasoning and your fine-tuning of clinical reasoning. And when I say clinical reasoning, I mean the thinking process, the clinical thinking process that you go through even before you start seeing your client, and then initial assessment, further assessment, and on to treatment. So before you actually see your client, there's information, you're at the stage of information gathering. You collect information with regards to the pathology, the diagnosis that the person has. You collect information with regards to what sort of symptoms they present with, how long they had them. Then you move on to do the initial assessment. And the initial assessment is about the first impression, is about the overall assessment, the quick overall assessment, to try and identify what the main issues are for this person. Then you move on to in-depth assessment. And in that further stage, you start exploring more deeply the various areas you think this person might have a problem with, and then you use specific assessment tools to assess them. I would like to propose to you that brain imaging can really help you with the clinical reasoning. It can help you with this process even before you see your client, at the point of gathering information about your client. The brain imaging gives you information not only about the pathology and the diagnosis, but it can also give you information about the type of functional difficulties that the person will have. And therefore, it already gives you an idea of what the clinical presentation will be. And so, instead of doing an initial assessment and then an in-depth assessment, you can move straight away to a hybrid kind of assessment in which you might do a little bit of an overall, but you already know what sort of specific functions you will need to investigate further. Brain imaging can really help you fine-tune your clinical reasoning and therefore optimize your care time, which, as I explained before, is really important during COVID time. So how are you using brain imaging during COVID time? Are you using brain imaging? How are you using brain imaging to refine your clinical reasoning? And how are you using brain imaging to refine your clinical reasoning during COVID? I would love to hear about your experiences, and I would love to hear about how you've been using brain imaging in COVID time. Leave a comment in here or a comment in the group, or perhaps even reply to this email. I would love to hear from you and hear about your experiences. And also feel free to share this video with your colleagues.